Welcome to this community update. Given the situation that we're in, where things are moving very rapidly, where further information about the COVID-19 virus is coming into the school almost by the hour, we felt it would be useful to have regular updates so people could be aware of the things that are being decided at the school and the reasons why. Over the weekend we had an extraordinarily busy period meeting with heads of schools and chairs of schools, and on one significant meeting that we held by teleconference with the Minister for Education, Minister for Health, various government officials and the Chief Health Officer from New South Wales. We have been trying to receive the most up-to-date and current information. I'm also very grateful to numbers of our families who are medical professionals who've reached out to the school and offered their comment on the current situation. The tension that we have is what is the best thing for Barker, and what is the best thing for all of our families, and what is the best thing for the wider community. And of course, none of these things are simple. To some extent, some people feel that an imminent school closure would be wise for the whole community. There are others who, including the Prime Minister, who argue that schools should remain in session for as long as they possibly can, and closure would have no impact on lessening the rate of infection across the broader community. So in the light of that information and some further information that we've received, the school has resolved to continue with lessons, but in a very considerably changed manner. We've moved assemblies away from Leslie Hall and placed them out of doors under the oval seating, soon to be called the Blackwell stand. We've moved chapel into Leslie Hall and spread the students right out across. All of this is intended to meet the objective that we've been advised is one of the most important, and that is some social distancing. Now, of course, schools are social institutions. Students love to be together. So we're trying to manage that in ways that are both positive, relaxed, a little bit of humour tucked into it as well, but nevertheless very responsible about how to manage the potential of spreading of infection should an infection occur. So we'll be armed with the best advice that we can manage, noting, of course, that lots of this advice can have contrary views. And we try to take the advice given to us chiefly by the medical authorities to whom we are responsible. We have resolved to make Wednesday the 18th of March a trial or testing day for online learning. So all students from Year 3 to Year 11 will be asked to remain at home and use their device to access the academic program remotely through the resources of Canvas. Our staff have been preparing for this for some weeks. It's time to put it to the test. When the students return the day after, we'll be surveying them to see how did that trial go and what are the findings. All of this is in anticipation of what could eventuate before the end of term, which is a necessary closure of the school and a transference to remote learning. Of course, we'll let you know well in advance for all of those things. I do want to say thank you to the community. I've received many messages. Sometimes those messages give useful advice, sometimes offer some criticism, sometimes full of commendation for how we're trying to handle things. We are firmly committed to living out our values in the way in which we are responding to this current situation. We're also very confident in the capacity of our staff and the agency of our students to make the very best of these circumstances and in fact enhance their own learning. If we make learning the centre of our work, we will all flourish. The co-curricular program will be substantially affected over the coming weeks. We're already aware of that, and we're sad that we've had to cancel or postpone a number of events that are highlights in our calendar. There's very little we can do about that. I'm very grateful to the students for how they've responded to this, and to the staff for how they've helped the students to live in a space of well-being through these difficult times. Finally, could I just encourage you to be in touch with the school should you have any concerns. The clinic and each of the heads of house and the year teachers are only too pleased to answer to any questions. Thank you for all your support and your encouragement and your advice. We will continue to keep you informed about developments in this very complex matter.